many medications.
Share of the economy.
It's because everything costs.
Germany,
A hip replacement in Belgium
the
costs
United States
$18,000. In the US, it's often over
$100,000.
$100,000. Today, I want to talk today about why healthcare costs in the United States are so phenomenally, fascinatingly expensive.
We spend more per person annually on healthcare than any other developed nation.
For everything from an angioplasty to a hip replacement, from a C-section to a pain reliever.
So how can I stop it? What do I do?
Honestly, nothing. We're stuck with this system.
Wait. The clips you just saw are a great example of the talking points that you hear when people talk about US healthcare, but they come to the absolute wrong conclusion that we're stuck with a bloated, expensive system. The solution is so simple and makes so much sense. It's a shame that people have kind of missed it so far, but that's what we're going to talk about today. The simple fix for healthcare. You may think that I'm talking about a single payer system where the government sets the prices for healthcare. This is how they work.
So like in the UK, the government goes out to all the people who make artificial hips and says one of you is going to get to make a crap ton of fake hips for everybody who is covered by the NHS. But you better make sure your fake hips are safe and you better make sure that they're cheap because otherwise we're going to give our business to a different company. And then all the fake hip companies are motivated to offer really low prices.
Not a bad idea, but a single payer system is still not a guarantee that the system won't become bloated, expensive, and bureaucratic.
There'd be nothing to stop lobbying from hospitals, from doctors, from drug companies, and those prices would get influenced. So we could end up with a single payer system that is expensive, even as expensive as our current system.
What I'm talking about is telling patients what the price of a service is before they receive that service. Currently, medical offices and hospitals will set prices for their services, and typically they only share this information with insurance companies. Insurance companies, then representing their members who pay a monthly premium, will negotiate a different price. And this new secret price can't be shared with anyone. It's in the contract. Then, an insurance company will process a claim that they get from a hospital and send the remaining bill to a patient in the form of a copay, coinsurance, or deductibles. The problem is when the prices are kept a secret between the medical offices and the insurance companies, there's no opportunity for patients to influence what the actual value and cost of these services is. If the medical providers and the insurance companies are able to keep the prices a secret, they can artificially inflate these prices.
I've got it. We'll make up a really high fake price and then give you a discount off that.
Hey, as long as I get to tell my boss we got it cheaper.
Now, the idea of letting patients know how much something costs before getting the medical service does have its naysayers. This is Ezra Klein. He works for Vox. This is his criticism.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it.
This is ridiculous because the number of individuals that are unable to provide consent for emergency or intensive care treatments is conservatively 1.25% of healthcare encounters. For the other 98.75%, we're either not knowledgeable enough or uncomfortable asking for that information, whatever that means. One of the reasons this is a flawed argument is actually provided by one of Ezra Klein's own co-workers. Another Vox video shows the worker and his wife trying to figure out the price of an uncomplicated baby delivery at a local hospital, and they're having so much difficulty getting an actual number. In the short term, medical providers and insurance companies don't want to give up this information because of a fear it will impact their bottom line. But don't take my word for it. Watch this clip and come up with your own conclusions.
So I decided to call around to some other hospitals to see if anyone could give me some general pricing information about the cost of birth. So my wife's pregnant. Because my wife is pregnant, but my wife will be giving birth. My wife's pregnant, and I'm trying to get an idea of how much different services cost, items that would be on a bill, different costs associated with the labor and delivery.
Okay, one moment. Okay, give me one second. Let me talk to my team lead.
Certainly. Let me connect you with the billing office.
I can connect you to our financial coordinator.
All I'll have to do is transfer you to the pricing line.
I can transfer you.
So now I'm being transferred to another line or something. I don't know. They're transferring me somewhere.
You can say things like
Please
coverage date.
Currently, all of our operators
Your call will be recorded. To ensure we provide you with quality service.
quality assurance purposes.
No music this time? I just have to sit here on hold with no music. I'm just trying to see if I can get a number.
You will not get a copy of that until after the procedure is done.
Okay. Do you have that information though in terms of like how much certain items cost?
No, they will not present the cost until after.
So there's literally no way for me to discover what the cost is until after I buy it. Is that right?
We do not keep that information on hand. Everything is processed after.
Certainly that information exists in your hospital system somewhere.
The itemized copy, all of that information is done after the procedure, not before.
I haven't heard a single number from anyone about how much anything costs. Whew, this is actually starting to become frustrating.
Giving patients the information on procedure pricing, especially in a non-emergent setting, before they commit to it, is a simple solution, but it isn't going to be easy to implement. For one thing, people are going to need a way to measure the quality of an outcome. And I have a whole bunch of videos on that. I'll link them above or down in the description below. But I predict if people start getting this information, despite more questions and perhaps more time in an appointment, that individuals will start picking more conservative treatments and picking things that fit better with their needs. I'm actually going to run a couple experiments that test this idea in my office. I'll make sure to follow up with some videos so that anyone interested in this topic can see how it works. All right, see ya.